I think I've started 5 patients already on Ozempic, and it's, 2 o'clock in the afternoon.
This injectable drug is in high demand by both Canadians and Americans, and not for diabetes, but for weight loss. So much so that British Columbia is taking steps to limit its sales and prevent a shortage. A drug that suppresses appetite, delays digestion, and increases the body's insulin. On Tuesday, the BC Minister of Health said that over 15,000 prescriptions of Ozempic were dispensed and sold to U.S. residents in BC pharmacies from January to February this year. 95% of those were prescribed by practitioners in Nova Scotia, something Dix says federal and provincial ministers should review, saying BC's supply can't satisfy the U.S. market needs.
It does not make sense for one or a few doctors in Nova Scotia to be prescribing Ozempic to American customers, and then having that Ozempic that's here for people in British Columbia be sent to Louisiana, to be sent to Arizona, to be sent to Missouri for patients there.
The medical director of BC Diabetes says he doesn't think a shortage is likely for the BC patients currently taking the drug.
I have not heard of any reduced access to Ozempic in the pharmacy, so I'm not overly worried about it. The manufacturer, Nova Nordisk, has millions of people on it worldwide, and I'm sure they can ramp up production.
He says while he doesn't prescribe the drug for weight loss for those who don't need it, he's seen society become increasingly obese, and there's no shame in taking advantage of a drug driven by technology.
There are lots of people who work very hard at Peaceful Mind, who work on healthy eating, on reducing unhealthy eating, who just can't lose weight, and for them, Ozempic is a miracle.
Patricia Lee was prescribed Ozempic by Dr. Elliott, and she says the side effect of suppressing her appetite will be good for her.
I'm one of these people that gets hungrier the longer the day goes on, and I crave something sweet late in the evening. And, digestive biscuits, good enough, but unfortunately, I shouldn't have those either.
The province says it's working closely with the drug manufacturer to make sure BC doesn't run out of the prescription drug. In Vancouver, Sarah Chu, City News.